Joining us tonight to discuss the latest on the WHO's pandemic declaration, the growing list of governments nationwide and local working to mitigate the spread of the Wuhan virus, Fox News medical correspondent Dr. Mark Siegel. Doctor, great to have you with us.
Hello, good to see you.
Let's start with first. Azar again saying that there have always been plenty of test kits, and that's just a fiction in the minds of some.
I wouldn't put it that way. I'm not going to directly disagree with the secretary, who I actually know well and I'm very impressed with. I think it's more the issue of how long it takes to get a result. So in other words, if I have a patient and I want to get a result, I've always been able to get it, but I may have to mail it up to Albany to get it. It may take 2 or 3 days. So there's always been a place to go for it, even if you had to go to the CDC itself. The issue is availability, how near in proximity to where I am when I want it, and what the turnaround time is.
We don't have an idea right now of the actual numbers of cases because we haven't seen a large testing of people who think that they have had it.
Correct.
Most local jurisdictions haven't had the ability to test. That's being corrected now. But the fact is we have been flying somewhat blind for some time because there hasn't been a wide dispersal of testing kits nor a coordinated reporting of the results of those tests, which is a bizarre thing to me, and I don't want to get into it. By the way, Secretary Azar is a good fellow, but this is not a time for any kind of nonsense with the language. We need to be forthright, and particularly those people speaking on public health need to be forthright and straightforward.
I've been making a lot of phone calls. They're just now gearing up to be able to do the kind of testing we need nationwide. And yeah, I also think there are thousands of undiagnosed cases.
I knew we'd get to the right place. It just took a minute or so. The fact is, we're not here to score points, and we're not here to in any way embarrass anyone. But my job, as you well know, here is to enlarge the body of public knowledge, and without as best we can, in any way either confusing or distorting the reality as we find it. Are you feeling better about what is happening now? This president has worked immediately to stop travel. Some now, after so many of his detractors argued that how dare he ban travel in any form, now the same critics are saying that he overdid it. And others are saying, we should have shut it down altogether. It's a bizarre list of criticisms from the left primarily and from his, I'll just call them detractors.
He's made these decisions based on available information, just as we have in terms of how many cases there are in the U.S. You realize we didn't know for a long time how many cases there really were in China. We don't know if cases were in Mexico, by the way.
I would argue we still don't know.
We still don't know, and we're told things are calming down. We don't know whether to believe that. Right. So he made these decisions based on available information. I think he made a very robust response to travel. I definitely agree with Dr. Fauci that it decreased the number of cases that we're seeing here in the United States right now.
And there were a lot of public health officials who were arguing with the president at that time that he should not do that. There was a reflex, a globalist reflex, I think, in part, that said, oh, my goodness, you cannot slow down travel. You've got to keep the great global commercial machine robust and ramping up all the time. He made a decision that he knew would be unpopular, and it was very tough. We're going to hear from the president tonight at 9 o'clock Eastern. What do you think he will say?
Well, we already heard from the WHO today that it's a pandemic, but as you said, we've been calling it a pandemic for a long time. What is a pandemic? It's sustained spread in different regions of the world at the same time. Our viewers know that that's exactly what we've been describing.
Right.
We've had a pandemic for some time. I think that the president is likely to call it a national emergency tonight. I think he's already mobilized a lot of resources. This will allow him to mobilize more resources because I think he's becoming aware that we're seeing a lot more community spread than we have documented cases. We got to try to catch up with that because we want the resources to be able to decrease the amount of virus spreading because we don't have a vaccine.
We don't have a vaccine, but a number of companies are making every effort to bring a vaccine to market, if you will. And amongst them, John Price, the CEO of one of those companies, Graphics, which is a genetic engineering, he says that with a declaration of the pandemic, we have an opportunity, if the president so chooses, to accelerate testing, trials, and move the product, if it is found to be safe and if it is found to be effective, into the market much sooner than would have otherwise been the case.
Yeah, and you know, Dr. Fauci's talked about one vaccine he
Right.
finds interesting, Moderna, but there's also Santa Fe. Here's what the most
And
important.
Inovia and
right.
a number of
But here's
others.
what a lot of them have
And
done.
Gilead.
Lou, what a lot of them have done are refurbishing vaccines that we started with SARS. In other words, we had the SARS outbreak back in 2003, and we started on the road of creating a vaccine, and we had a lot of promise. That was shut down when SARS went away. So we're halfway there already. That's why we're starting clinical trials over the next month. Now, Fauci says a year and a half. The reason he's saying that is because you don't want a situation where you give a vaccine.
Well, the reason he's saying it is because that's the standard approach. But we are reaching a level here that is different than anything that we have seen since, one could argue, since the swine flu, which was the last time the World Health Organization declared a pandemic.
We rushed a vaccine with swine flu 6 months.
Right.
We did a vaccine from beginning to end and got it out to the market in 6 months.
And it was effective.
Yes,
and it made a
yes,
big
it was
difference.
effective, and that pandemic ended up being milder than we expected it would
So
be.
that-
Yes, that was quite effective.
And so we can only hope that we will be as fortunate, and these companies, genetic engineering companies, will be as successful as they were in 2009 in bringing that to market.
Because that's exactly what we need. Genetic engineering, bioengineering, rapidity of creation, get it out, give it to massive amounts of people.
Dr. Mark Siegel, always good to have you here.
Thanks, Lou.
Thanks so much.